University exam, very frequently you get a long question on that. You have to write down everything about that, starting with the pathogenesis, classification, clinical feature, lab diagnosis, treatment, and prognosis. So let's start the topic. AML, acute myeloid leukemia, also known as AML. So let's start it. So first of all, there are 4 types of leukemias in our syllabus, that is CML, AML, ALL, and CLL. There is a separate video on all of them. I request all my dear students to watch the 4 videos in a continuity back to back so that you will have a crystal clear concept and better understanding. I request all my dear students to take out their notebook and pen and start filling this table with me. If you have the hard copy of the book, the table is given to you. You just start filling it. Under a fixed set of headings, we are going to discuss all types of leukemias. So the fixed set of heading is, first of all, I will let you know the introduction, then age, then pathogenesis, classification, clinical feature, lab diagnosis, treatment, and finally prognosis. So we will discuss AML also under the same headings. So let's start AML. Let me tell you the introduction and age of AML. So let's start with introduction. What is AML? What is AML? What is happening in the AML? So can you see the diagram? Now, I guess you can understand this basic diagram. You have watched my video on classification of leukemia lymphoma. You can understand it, how the WBCs are formed and they are coming in the blood. And you know what is leukemia? Normally, the blasts are present, the 2 type of blasts, the myeloblast and lymphoblast. They are present in the marrow. In the marrow, the blasts are present. So having blast, the myeloblast and the lymphoblast and the marrow is a normal thing. But once they do uncontrolled mitosis, they replace all other cells and they come in the blood. They spit it in the blood. So in the blood, they are not normal. Once they come in the blood, it's known as leukemia. It's known as leukemia. So what is leukemia? I hope you can understand. So what is happening in AML now? In AML, myeloblast is doing uncontrolled mitosis. The myeloblast is doing, due to the mutation, I will tell you the name of the mutation also. Because of the mutation, this myeloblast is doing uncontrolled mitosis. It replaces all other cells in the marrow and it is pitted in the blood. Once it come in the blood, so blood have 99% of the cells are myeloblast, and that is AML, acute myeloid leukemia. After coming in the blood, this myeloblast enters solid organs, many solid organs like liver, spleen, lymph node, bone marrow, other solid organs, and it will produce discrete masses in the solid organs. So first, the malignant cells. By malignant cells, I mean the myeloblast. Myeloblast first come in the blood, cause the leukemia, and they infiltrate in other organs and they convert into lymphoma. So first leukemia is there and then it converts into lymphoma. This is AML. So you have to learn 3 things in the AML. In the definition, you can see the first thing you have to learn, we are talking about the myeloblast. So the uncontrolled mutation, mutation leading to uncontrolled mitosis occurs in myeloblast. So myeloblast come into the blood, causing leukemia, AML, and after coming in the blood, it infiltrates into multiple solid organs. So this is the definition you have to learn. So the myeloblast first come in the blood and then infiltrate in the solid tissue. Learn the definition. What is the age? Most commonly it occurs in middle age. So it occurs young to middle age, that is 15 to 40 years. In contrast to CML, which occurs more than 50 years. One more thing you have to understand here, in CML, all 5 precursors come in the blood. I told you CML. So there is a separate video on CML. Please watch that. In CML is also myeloid malignancy. So in CML, all 5 precursors do uncontrolled mitosis and they come in the blood. I mean myeloblast, promyelocyte, myelocyte, metamyelocyte, and band form. But in contrast to CML, in AML, only myeloblast is coming in the blood. Other precursors are not coming in the blood. So please understand that. So coming on the pathogenesis. Now I have to tell you the mutation which is taking place in the myeloblast, because of which it is doing uncontrolled mitosis. Name the mutation. Name the mutation. So there are many mutations, but 3 are most common. So first is 821 translocation. So you know human cell. Let me draw a human cell for you. This is the human cell. This is the nucleus of the human cell. In human cell, total 46 chromosomes are there, or rather you say 23 pairs are there. So this is pair number, you can say this is pair number 8 and pair number 21. So translocation takes place either in 821 or takes place between 15 and 17, or the pair number 16. There's a gene which gets splitted and inverted, that is inversion 16. So these are the 3 most common mutation: 821, 15, 17 and inversion 16. So because of any of these mutation which is taking place in the myeloblast, any of these 3 mutation. So in the myeloblast, you can see this is the myeloblast. Either 821 translocation is taking place, or 1517 translocation is taking place, or inversion 16 is taking place, because of which it become malignant. It is doing uncontrolled mitosis. It replaces all other cell. It is pitted in the blood. So blood have abundant of myeloblast, 99%, and then it infiltrate into solid organs and convert into lymphoma. It is only myeloblast, not other cells. So please learn the three